Peel police say they broke up a house party with as many as 200 people over the weekend. Authorities spent an hour clearing out the massive party. According to neighbors, barriers were erected so passers-by couldn't see over the fences. Under Ontario's emergency rules, gatherings in Peel region should be limited to 10 people with physical distancing in mind. The property owner has been charged and could face a fine of up to $100,000. Brampton's mayor, Patrick Brown, believes that charge is reasonable.
People said, why would you have fines as significant as 100,000? I can't think of any scenario. Well, these are the scenarios that we envisioned. In this case, if it's a $750 fine, it would be issued right away. If it's a more egregious fine, a more significant fine, then the bylaw officer will refer it to the courts to determine the amount. And so in this case, it was immediately referred to the courts, understanding that this was not going to be a typical fine.
With more, I'm joined by infectious disease specialist Dr. Sumon Charkrabarti. Dr. Chakrabarti, good morning to you. Talk about a super spreader. Wow, 200 people. Brampton's still in stage 2, so they're supposed to only have 10 people gathering at a time. What are the consequences of a gathering of this size at this stage?
This could be not so good, and I mean that sincerely. When I look at this, I don't know the exact details of who was at this party, but there's a possibility that it was a cross-generational party. And in that situation, you can have several people who are more vulnerable and get infections. And of course, whenever you have a gathering of this size, it could have reverberations in the community, and again, more vulnerable people being the brunt of this. So we have to really keep an eye closely on what happens in the next couple of weeks, and hopefully it's nothing too bad, but I'm glad that law enforcement went in on this one because this was bad.
What needs to be done to reach the age group? And again, we don't know what age people were at this gathering of 200. It could have been young up to old, but what do you think needs to be done specifically to reach that sort of 20 to 40 age group that we see the most cases in right now?
I'm sad because I'm not in that age group anymore, but I think that just out of it. But one of the big things I think is that I've seen a lot of finger wagging, and we don't want to be scolds. We have to kind of, again, stress the importance of why we're doing this, the social responsibility, and also certain things that can cause behavior change. For example, the circles on the grass at Trinity Bellwoods, the literal bubbles on the beach that can kind of change behavior in a way that's not really, it's almost subconscious. And I think that these types of things have to be considered, and also messaging that, again, is informative and not scolding in nature. It's going to be tough, and I think that we are going to see more clusters in the coming weeks.
Okay. On the bright side, in Nova Scotia today, no new cases. What does that say about how Nova Scotia managed the virus?
I think they did an excellent job. And, across the country, we saw some very shining examples. Of course, the one thing is at the very peak of COVID, the Eastern Canada wasn't all that badly affected as places like Ontario and Quebec. But, kudos to them for a great response. And it's great to hear that there's right now 0 cases. I don't think it should be looked as a failure if we do see more cases, because we will, and we should expect to see clusters here and there. And as long as these clusters are identified quickly, we can snuff them out before they become big fires.
And it continues to be a much different story south of the border. Florida now reporting more cases than New York. How does Florida get things back on the rails to at least the point where they can control the virus, Doctor?
I think that the issue with Florida is that they really have to do what we know is the first principles, is go back to the physical distancing. They have to do a lockdown at this point. And even if they do that, they're going to see things get worse before they get better. But they have to do something before anything is gotten under control, because things are going to get bad there, especially with the hospitals at almost 100, actually, if not more than 100% capacity.
How long, if they started today, Dr. Chakrabarti, how long would it take for them, again, to get it under control there?
It of course depends on how the healthcare systems in the area can respond. But I suspect it'll be something similar of what happened in Italy and in Spain and New York City, on the scale of 4 to 6 weeks or so.
Okay, Dr. Chakrabarti, great to see you. Thanks so much.